Yes, here we go. Very interesting event that just happened here, but thank God we're connecting and we'll be starting in a second. Yes. Okay. Oh. Chai. No. Oh, wow. Good evening, everyone. Welcome to Medical Mondays with Dr. O. We're here for another interesting session to learn about our saliva, spit, sputum, and how they reflect our health. I can't wait for this one. So I'm Toyin Okwesomi. I'm a physician, family practitioner, HIV specialist, and I treat addictions in Maryland. I enjoy sessions like this and medical missions, health fairs, any way to connect, to bridge health disparities, to learn and to teach. I enjoy. So, and we have one of our very own again tonight, Dr. Oluwole Ajagbe, who will be telling us more about how to better our health. We don't establish patient-physician relationships on this platform. We will answer questions as they're asked, but we'll, refer you to your physicians to, engage in further care. So without much ado, I'm going to hand over to our very own, again, Dr. Ajagbe. Welcome, sir.
Good evening, everyone. Thank you, Dr. O. I'm very pleased to be with you tonight. It's supposed to be an exciting topic to talk about, and I hope I'll be able to pass some information across. If you have known about this before now, this will be like a reinforcement. But if you haven't heard or haven't known specifics about the topic tonight, it's okay. You can learn, and there'll be opportunity for you to ask questions to further expatiate on whatever it is that you will love to know more about. Thank you so much for asking me to give a talk on this topic. And I think as a dentist, it's one thing that professionally, you have to come in contact with spit every day. Every day you see a patient, you are constantly interacting with spit. But for the lay person, you really don't know that there's a difference between the spit and the saliva. Most of the time, we just use them interchangeably. I hope everybody can hear me. Can everybody hear me?
Yes, you are very clear, sir.
Okay. So for most lay people, we just say spit, we say saliva, and we assume that is the same thing. But tonight we're going to try to differentiate between the three names that are in the topic. The first one is saliva, the second one is spit, and the third one is sputum. Most of us, we know these things, but we don't fully understand what they really are and what they do, what they are made up of, or sometimes we just assume the three are the same. But tonight, I would like to just present to you that there are three different things. They may be close together and they could co-mingle, they could be mixed together depending on what the condition is in the individual. All right, let's just start. as you look on your screen, or if you don't see your own picture, and you can see my picture, at least you can see from my head, from the top of my head to my chin, the middle portion of my face and the lower third of my face are the areas where we deal with all these secretions that we're going to be talking about tonight. So let's start from the top. The top part is the nose. The nose has two holes. The anterior part of the nose has fine hairs. The fine hairs are supposed to help to trap, the particles that will, eventually end up in the lungs if there's nothing to block their entrance. So the hair stands to filter the air going into our lungs. In the posterior 2/3 of the nose, we have the soft lining, which we often refer to as the Schneiderian membrane. That's a big name. It only means the lining of the nasal cavity. Now, this Schneiderian membrane, or the lining of the nasal cavity, is rich in secretory cells. The secretory cells are called goblet cells. They look like wine glasses. The primary goal is to secrete mucus. And mucus, as we will talk about it in a few minutes, will be, I'll distinguish between them and other things that we are familiar with. So the mucus is secreted in the back of the nose, and that secretion can increase. Usually when there is cold, somebody is having an allergic reaction, and there is runny nose, and even if there is no fever and there is no infection, if there is any form of irritation in the nose, there will be increase in the secretion of the cells in that area of the nasal cavity. And when that happens, by gravity, they will drain forward to the front. But if it's too far back where the secretion starts, it will be dripping to the throat. And so we have the area of the nasal cavity that extends into the nasal pharynx or nasopharynx. That is the space between the nose and the larynx, where is the voice box, is called the pharynx. So the secretion there is not saliva. The secretion there is not sputum. The secretion there is just simple mucus. So when you see somebody that sneezes and something comes out from their nose, that is not sputum. That is just nasal mucus. Some people refer to it as booger, not the booger that we were dancing to earlier on, but most people have heard of the term booger before. So when you see that, know that that is not saliva, and know that is not sputum. Now, if you go down beyond the pharynx, that is where the voice box starts, and then you go below that into the lungs, all the linings of the airway, all the way to the final destination in the lungs, the smallest sac, they are all lined by cells that have the capacity to secrete mucus. The mucus that is secreted in the lungs or in the lower airway, when they are composed together, is what we refer to as sputum. Everything that comes from the lungs in form of secretion will be referred to as sputum. So now we can see the difference between mucus, sputum, and then we're going to talk about the saliva very shortly. So the phlegm, the term phlegm is often used to describe what comes out from the lungs. So when you get the secretion coming from the lungs, which is usually very gelatinous or mucinous, they usually are trapped. I mean, they usually trap uh, foreign particles, bacteria, dust, dead cells, apart from what the cells itself secretes. So when the secretion from the lining of the lungs or the respiratory tract, the lower respiratory tract, usually has three layers. The three layers, I don't want to bore you with all the details about that, but what the lowermost layer is the part that is right on top of the lining of the respiratory tract. And that is usually very watery. And it is the part of the secretion that covers the hair-like structure that we call cilia, that is covering the whole surfaces of the respiratory tract. The function of the hair-like structure is to move the secretion to the throat so that the secretion can either be swallowed or spat out. So the lowermost layer of that is called the salt layer, which is pretty much like water. And then the middle layer is kind of has a little bit of fatty type of secretion. And on the top, we have the mucinous part. And all of this together will form what we call the sputum. And within the sputum, you not only have the secretion, but you have the foreign bodies that have entered into the lungs inadvertently through breathing, and dead cells from the lining of the respiratory tract will also be engulfed inside the secretion and be propelled out by the hairy structure that we call cilia as they move in wave-like form to propel the secretion to the throat. Once the secretion gets to the throat, you have the two options of swallowing or spitting it out. And when this is one of the ways by which the body keeps the airway clean from all the junks that we inhale, whether intentionally or unintentionally. As we breathe, there are so many things that go into our lungs. So we've talked about mucus, which comes from the nose. We've talked about sputum, and that's just a simple introduction of the sputum. Now, the color of the sputum and the texture of the sputum are very, very important in determining what state of health one is in. The first color that we will talk about when we talk about the color of the sputum is either colorless or clear colorless or grayish white. In this case, most of the time it's normal. There's nothing going on in the lungs. It's normal lung, and there is health, and there is no infection or inflammatory process going on. Now, as you further, as the secretion is retained without being moved to the throat, there's the chance that white cells will also be coming into the secretion. And so the white cells are migrating from the capillaries. Those are the finest blood vessels in the lungs. And those cells, they can move. They are like amoeba. They are able to move apart from being floated through the blood system. They can move between cells. And these are there in the secretion as well. And they can help to engulf the bacteria and destroy the bacteria and so on. So all of this together, forming the sputum, they has to come out of the lungs for the lungs to be healthy. So when the lung is healthy, the secretion is colorless in most cases, or lighter in color. So now the sputum can be yellow, which is signifying that something is going on in the lungs. If there is pus in the lungs, the sputum will have that tincture of some pussy, component to it. And so the color of the sputum is very, very important. So when your doctor tells you, we are going to take your sputum, they're not asking you to just spit for them. They're expecting you to cough something up from your lungs and be able to spit it out into the container for them to test. The kind of test that they do will include checking for bacteria or viruses, or checking for exfoliated cells, which may indicate that there is cancer or precancerous changes going on in the lungs. Also, they can find cells if there's a need to determine some things through the exfoliated cells in terms of DNA, and all of that can be determined from the sputum as well. Now, if the sputum is yellow, you know that there's infection, and the type of microorganism will determine the degree of yellowness of the sputum. So the sputum can also be as dark as green, and that shows the kind of organism. Usually anaerobic organisms will cause the sputum to be greenish, darker yellow stroke green in color. So I think some of the times you find this pneumonia when somebody has a deep-seated infection of the lungs. They can cough that up, and that will be the color that you see. Now, occasionally, the sputum can be streaked with blood. The color of the blood or the redness of the sputum would determine whether this is a fresh blood. If it is bright red, it will be referred to as a fresh blood. If it is darker red, it will be referred to as an old blood. And the color of the redness, the depth of the redness will determine whether it is a fresh source or an old source. So sputum can have blood in it, and most of the time, if it is not due to injury from repeated intractable coughs, it will be as a result of some kind of tear or something in the lungs that causes blood to come up. If the blood is fresh, you know that it's an acute situation. Then, of course, whichever way the cause has to be underlined, has to be detected and managed and treated appropriately. When it's seated down, in most cases, if it's not the fresh kind of blood, and it's somebody who has chronic cough, and they have not done their TB test ever or in a long time, it may be necessary to check it, because blood in the sputum is one of the clinical signs that the doctors look for in people that have TB, tuberculosis. Now, if the sputum is very sticky and it's brown in color, most of the time it's as a result of a chronic condition, as in the case of bronchiectasis or COPD or chronic asthma. Most of the time, the sputum in that case will be very sticky, and most of the time very difficult to cough up. And so that is one color that we need to observe. If your sputum, when you cough up and it's that color, it's more likely that you have something to do, either you have chronic asthma or you have COPD, chronic obstructive pulmonary disease, as they call it. Now, sometimes the saliva can be gray, deep gray, or black. And when that is the case, the sputum, I'm talking about sputum, not saliva. If the sputum is dark gray or saliva or black, it is more likely due to pollution particularly for those who, smoke heavily, those who work in a coal mine. There's a condition called pneumoconiosis, which is as a result of the trapping of the coal dust in the lungs and causing a whole lot of destruction of the respiratory system. So we can see that sputum, when we talk about sputum, anytime you hear about sputum, it is not primarily from the mouth, it is from the lungs. Now, it has to pass through the mouth in order for you to submit it for examination or for lab tests. So in that situation, when the sputum comes from the lungs, comes to the throat and comes through the mouth into the receptacle or the collecting jar, it means the sputum is now tainted with saliva. With spit. So if you're really looking for what is in the sputum, well, the lab knows how to separate whatever it is they want, and particularly if it's something to be cultured. If there is no similar condition in the mouth, if there's TB in the sputum, for instance, and there is no lesion in the mouth to suggest TB, definitely it's coming from the lungs, not from the saliva or the spit that mixes with the sputum while the sample is being collected. Now, let's come to saliva and spit. Saliva is simply the secretion that comes from the salivary glands. This is not a lecture in anatomy, but I just wanted you to know that there are major salivary glands and there are minor salivary glands. And just for the sake of understanding, we have heard about people that have mumps before or swelling on the sides of their faces, and they say, oh, it has something to do with the salivary gland. Most of the times we don't know what it is, because as layperson, you just know there's a swelling there. But once there's a swelling in that area, there might be pain when the person needs to chew something and the saliva secretion needs to come out, particularly if there's a blockage in the ducts. Anyway, so we have major salivary gland, and then we have minor salivary glands. Now, the major salivary glands are 3. They are paired. So basically, you have 6 of them. You have one on either side. The biggest of the salivary gland, we call it parotid gland. That is found just wrapping around the back of the lower jaw. So if you feel around your neck, below your ears, the chances are that you are touching under the skin, you are touching the parotid gland. There are other major salivary glands. The second larger or the larger salivary gland is the submandibular. Submandibular means is below the lower jaw. So if you put your thumb under your jaw on either side, you can feel certain nodules, certain bumps there. Usually it should not be very easy to feel unless you have infection there or you have some other conditions going on in there. So as I'm feeling mine, if you can try to feel yours too, you may not be able to distinguish what is salivary gland. But right there under the jaw, right there, you would know definitely that's where the submandibular gland is. Now, the third, which is the smallest of the major salivary gland, is called the sublingual. Sublingual just means below the tongue. So if you raise your tongue up and you put your finger on either side, if you put your 2 fingers on either side of the midline and you press down on the floor of the mouth, you will feel certain nodules there, that is where the sublingual salivary gland is. Now, these major salivary glands, the only way they get their secretion into the mouth is through what we call the ducts. They are like tiny tubes that comes from each gland, and they are all, on either side of the jaw, and they open right into the mouth. The one for the parotid gland, the biggest one, open up in the cheek, way up there. If you move your tongue, you feel some things towards the back, on the side of your back teeth. You feel like a little fold that is there. Usually there's an opening there where the saliva comes from in the parotid gland. When you yawn or you speaking, and all of a sudden there's it's two streams of saliva that's kind of just jet out from your mouth. And usually sometimes when you are hungry, that will happen. You're talking about food and the spit comes out. In some local places, they make joke that the snake is spitting from your mouth. Anyway, whatever that is coming from the submandibular gland. That's the second larger salivary gland on either side under the jaw. The sublingual has many tiny ducts, pipelines that they use to secrete, to carry their secretion into the mouth. So if each of these secretes their own, passes their own secretion, they will mix together, and they will mix together not only with themselves, with each secretion, they will also mix with the remnants of food in your mouth. They will mix with bacteria that's in your mouth. They will mix with dead cells in your mouth. And all of this together is called spit. So you can see from the parotid gland by itself, it is saliva. From the submandibular, it is saliva. From the sublingual, it is saliva. But when you mix the three together and you mix it with all the other things that are present in the mouth, then that is called the spit. Now, saliva and the spit put together, and all the saliva put together and all the constituents of it, when it's analyzed, it is found that saliva is made up, the spit is made up of 99.5% water. So the 0.5% that is left is made up of minerals that we call electrolytes, like dead cells from our mouth, leftover food, bacteria. We have antibodies, which is from the salivary gland. We call it secretory IgA. That is immunoglobulin that is secreted from around the salivary gland. We have other immune cells, white cells that are protecting the mouth from all the bacteria that are floating around in the mouth or in the secretion. So now, how does this reflect our health? Most of the time, when we don't drink enough water and we are dehydrated, every fluid in our body will suffer from that dehydration. First of all, we will not be able to have enough saliva in our mouth. So our mouth will feel sticky, our mouth will feel dry or patchy dry, and most of the time there will be increased deposition of plaque, which is what causes trouble both for the gums and the teeth. And speaking when the mouth is dry is often very difficult. So saliva serving as lubricant is very, very important. And hydration is very, very important for us to be able to have a very good oral environment. So now 99.5% water, and the rest is the additives coming either as electrolytes or cells, the dead cells that can serve as sources for DNA tests, particularly for those who are trying to do paternity tests. Usually they'll just take swabs of the mouth and from the saliva, and they can spin it down and get the cells and do the DNA test from that. Now, if you are well hydrated and you don't have any infection in your mouth, your saliva, your spit should be strictly 95.9.5% water and the electrolytes and the other things that we say. Now, if there are some systemic conditions going on in the body, for instance, if somebody has fever that is resulting from bacterial infection in the throat, generally, the bacteria will spread to the mouth, will be present in saliva. Remember, anything that is not coming from the lungs cannot be called sputum. So if it's coming from the back of the throat, that is coming around the oropharynx, that is the back of the mouth, that is connected to the back of the nose. When it comes into the mouth, it mixes with the salivary secretion, and that will form part of the spit. And in most cases, that kind of spit will be very sticky, will be more mucoid, and may have a pus. If there is pus secretion in the back of the throat, it will be part of the saliva, of the spit. You can see how difficult it is to, you have to remind yourself that spit is not the same thing as saliva each time you are speaking, because even me, despite my experience, I still mix them up when I'm talking. But I have to always remind myself that if it's coming directly from the salivary gland, that is spit, and that is saliva. And once it's already in the mouth and it's mixed up with every other thing, it is spit. Okay. So most of the times we swallow our spit, and when we swallow our spit, we cleanse our mouth, we remove all the things that are in the saliva, in the mouth, that are not supposed to be there. We swallow them, and the digestive process takes over. Another thing that is very important that is present in saliva are the enzymes. Enzymes, I hope it's not too big a word for every one of us, but enzymes are just like chemicals that are present in the saliva that help with the food digestion. The digestion of carbohydrates like bread, yam, rice, cookies, and everything that is carbohydrate starts from the mouth. And as well as fat. The digestion of fat also starts from the mouth, but they don't conclude in the mouth. They start from the mouth and they continue in the lower GI tract. Now, the enzymes that are present in the saliva are called amylase. That's a big word, but it only means the saliva the enzyme that breaks down carbohydrate. The one that is called the lipase is the one that breaks down the fat, starts the breaking down of fat in the mouth. But the word lipase is coined from lipids. Lipid is a technical word for fat. So when you eat anything that has oil in it and has carbohydrates in it, the digestion of both starts in the mouth. The digestion of proteins does not start in the mouth, it starts from the stomach. And so we're not going to go beyond that in this discussion. Now, another thing that is contained in the saliva that reflects the kind of health that we have is the amount of mucin. or mucus that we find, that is present in saliva. When there's increased mucin, it means most of the secretion is coming from the sublingual, which is almost 80% mucous cells with serous demileuns. Very few serous components are present in the sublingual gland. So the sublingual gland will secrete almost purely mucus secretion. That is the secretion that is very sticky and stringy. So you see some people when they are talking, you see strings of saliva connecting their upper and lower lips together. And that's usually a sign that most of the saliva coming into salivary secretion in their mouth is coming from the sublingual gland. When your mouth is very clean and you are not eating anything that is proteinous, you may not have as much of this mucous salivary salivary secretion coming from the sublingual gland. If you are eating anything that is dry, that is carbohydrate in nature, the primary secretion will come from the parotid gland, which is the biggest major salivary gland on either side of the jaw. So that is the reason why when you are chewing bread, you are chewing cookies, your your salivary secretion or the spit in your mouth will be watery. And that is to help to mix whatever it is that you are chewing with the enzymes so that the digestion of the carbohydrate can begin in the mouth as it goes down into the throat, into the esophagus, and into the stomach. So let me stop here. So I'm sure there'll be a lot of questions, and that will help us to go into other areas of the topic. Thank you for listening.
Thank you so much, sir. So that again is another difficult talk that you flawlessly presented. It sounds like, oh, it's just easy. No, it's not. Anyone who is a scientist or a physician on the forum will know that putting all of those together the way you have done is just amazing. Thank you so much again, Dr. Ajagbe, for
You're very welcome. Yes.
that depth. So we have Sister Lola. Go ahead, ask your question.
Good evening, everybody.
Good evening.
Thank you, Doctor, for the presentation. I was like, what is it that I have to learn? But I've learned a lot. Thank you. I have a question. I always have problem swallowing my own saliva. My secretory gland will automatically secrete saliva involuntarily. And most of the time I spit it out. So am I doing myself any good or no?
Well, if you know you are healthy and there's no reason why, this is occurring to you and you are hydrating regularly, I don't think you are doing anything wrong. However, you control your hydration by swallowing your spit. You don't want to be too dehydrated before you drink. But if you are constantly sipping something, you will not be spitting up because whatever you are drinking is acceptable to you and you will be doing that. Now, there are some involuntary conditions like you described when there's so much salivation going on in the mouth. And then even talking becomes a problem for such people. If you don't have any infection in your mouth, I think the best thing for you is to swallow. Swallow your saliva. It's yours. It's not contaminated with anything other than whatever you put in your mouth. So but I don't see any medical condition that is attached to excessive salivation, other than the fact that your salivary glands are functioning perfectly well.
So, Dr. Ajagbe, she did say that
I want to add
that she salivates involuntarily. Is salivation voluntary to start off with?
This
No.
is how it started. Let me explain further. I woke up, every time I wake up in the morning, I wake up with saliva in my mouth, full. I can't talk until I do something, swallow or spit. Number two, if I smell anything that irritates me in surrounding, it doesn't matter where or what, my secretory gland voluntarily secretes salivas.
Well, okay. So there are two different things. When you sleep and you wake up at night, because subconsciously you remember that you ate, and then you remember that sometimes, it's not all the time for most people, but because you remember that the saliva that collects in your mouth when you are sleeping, because while sleeping you don't swallow, or because you are not conscious, or something is flowing into your throat and you wake up and you swallow, reflexly. But most of the time, all of us, including myself, will wake up with saliva in our mouth. Particularly if you never woke up at night to use the bathroom or, drink some water, because some people will wake up at night to drink water. Now, if all you have is because you woke up in the morning and you have saliva in your mouth, I don't think it's abnormal, because I do. It happens to me as well. Maybe not every day. Now, if you smell anything that is offensive, even as offensive as somebody's body odor, yeah, some people can't stand it and they will salivate, and they, because it's a pleasant smell, they will have to spit it out because it's not something that is palatable to them. So I don't think you're doing anything wrong to spit if you smell something offensive to you. And yes, Dr. O asked the question, is salivation voluntary? It is both. It could be involuntary. It's generally involuntary because as you function, you don't know when saliva is coming in your mouth. You just know that there's saliva in your mouth, right? But occasionally you really want to cause saliva to come out, particularly when they tell you to collect saliva. And say, oh, we need 10 mils of saliva from you. Well, it's not easy to collect 10 mils of saliva spontaneously. It's not going to happen. So even in our physiology class, we will be given a piece of wax to chew on. We have to chew on it for a period of time to collect up to 10 mils of saliva. That's a lot of work. In that case, that is voluntary because you are actively stimulating the saliva to do that. You don't have to do anything. As soon as you see food coming or you smell French fries or something, if you like French fries, your mouth starts watering right away because you remember that the smell and you are associated with the taste. So that might be what happens in the case of Pavlov's theory. I'm not sure if anybody remembers what that is all about. When the dog hears the bell because it knows there's food, it salivates. That kind of reflex. When we see food, we smell something that is nice, that is palatable, our mouth will water.
Thank you so much, sir. However, for Sister Lola, there's still somehow, I still think there's still maybe something that can be, beneficial. I was just thinking in an instance of pregnant women who salivate a lot, during pregnancy. They don't do this when they're not pregnant, but during pregnancy they salivate and they don't or can't swallow they can't swallow the saliva. They spit it out because it nauseates them. if they attempt to swallow it. Is that maybe similar to what Sister Lola is experiencing, not pregnant? I'm just wondering.
Well, she will have to tell us if she's pregnant. I mean, most of the pregnant women that are, probably will have it in their first trimester, and then they have morning sickness and they have continuous nauseating feeling.
Dr. Ajagbe, I know women who have it for their whole 9 months. They just don't swallow. They can't swallow their sputum.
Yes, they should. Well, because it's nauseating to them, they cannot swallow it. But generally,
you're asking if she's pregnant. Are we going to have a medical Monday baby shower? Because that question is
it's loaded. Okay,
it's loaded.
Because Dr. O just raised the point that those who are pregnant may have, do have such, copious salivation which they don't swallow, and if she's pregnant, definitely there is a possibility.
No, there's no baby shower. It has nothing to do with pregnancy.
Okay, thank you for clarifying that. So we can just say directly that salivation naturally is involuntary. We don't choose when we want to salivate, when we want to eat. It will come naturally. And when we are speaking, we have to remember that our mouth needs to be lubricated. And so the salivary glands constantly secretes. And that's why most of the time we swallow before we speak. We find out there's so much saliva in our mouth, we take a short break, we swallow, and then we continue speaking. Even just as I'm speaking now, I take short breaks, even though you don't know that I'm swallowing, but I have to do it, because otherwise there'll be too much saliva in my mouth and it's not going to be pretty.
So, okay, finally, I'm sorry. The early morning saliva that I have, is it okay to swallow?
Well, I would say if you are conscious, okay, and you don't want to choke on it, you just get up and spit it out, because what has happened in your mouth is fermentation overnight, particularly if you never brushed before you went to bed. Remember, I said that we have some enzymes in the saliva. The enzymes continue to break down whatever leftover foods between the teeth, on the teeth surfaces, in the cheek, on the tongue, on the top of the tongue. The top of the tongue is very rough, and most of the things that we eat are trapped in the fine-like hair structures on the top surface of the tongue. So if you swallow it, well, if it doesn't repel you, fine. It's not going to hurt you, because you have hydrochloric acid in your stomach that would deal with whatever else is there. You don't have to worry about it. But normally, I will spit it out. If I'm getting up, I'll spit it out. And if it's time for me to brush, I'll brush. Then after brushing, I can swallow my spit.
Thank you so much, Dr. Ajagbe. Sister Lola, I would like you to pay attention to something, to just see if swallowing your sputum causes you nausea or gives you some discomfort. You might not have been particularly attentive to that. Watch it and see if, that's an issue. Okay.
Dr. O, not sputum, saliva.
Saliva. I'm sorry, saliva. Thank you.
Yeah, I was going to say the same thing.
Saliva. Thank you so much. So just watch it and see if you feel discomfort when you swallow, because that would answer a huge part of that question.
Yes, you're right, Dr. O. If somebody has sore throat, for instance, the chance are that they will have more saliva in their mouth because of the sore throat. They can't swallow easily, and they pull it in their mouth, particularly children. That's how you know that a child has sore throat quicker, when you see them storing saliva in their mouth, or they are drooling on the corners of their mouth because there's so much saliva in their mouth.
So one of our docs just informed me that artificial chemicals, additives also can cause overproduction of saliva. So there's a lot we need to look into there. So please pay attention to these things and see if it can be tweaked out. We can have further conversation off record. So in line with what you just said, Dr. Ajagbe, Sister Shade said, what about little children who salivate in their sleep, waking up choking? I ventured to talk about it right away. Auntie Tawa, I saw your hand just because it tallies exactly with what Dr. Ajagbe just said. So, Dr. Ajagbe, is it
Yes.
correct to say that children like that probably have, maybe sore throat or something is wrong? Is why?
Yes.
Okay, go ahead.
Yes. When a child starts drooling, if the child is at the stage of tooth eruption, that is, their teeth are coming out, they definitely will. There will be increased salivation in that condition. If they have toothache and it's bothering them and it's causing them to have a little bit of tenderness around their throat, even though they don't have any sore throat per se, but they have lymph nodes that are swollen around their neck, around their throat area, they will not be able to swallow easily. And in that case, they will have a lot of saliva in their mouth. So anytime you see a child with lots of saliva in their mouth, something is going on. So they must be checked out. It is not spontaneous, copious salivation that takes place. Now, you have to bear it in mind when they sleep and have what we call incontinent lips. That is, their lips don't come together when they sleep. Even the little saliva they have, they will drool. And that's what will dry up around the corner of their face, or corner of their mouth, and extend it to their ear when they wake up in the morning. If it's dry, it's just a short period of salivation or drooling that took place. But if it is wet all the way through, in the morning, that child has been salivating all through the night. So if it is dried, that is not likely to be because of infection. But if it is, very wet and they still wake up with saliva in their mouth, they need to check. The parent needs to check their mouth and see if there's anything going on there.
Thank you so much, sir. Auntie Tawa, the floor is yours, ma'am.
Good evening, everyone.
Good evening.
My question is not much. It's about the color of this, whether sputum, saliva, or spit. Does the color affect us, or the odor? When they have color, when they have odor, and is the odor of spit different from the saliva and sputum? And does that indicate any organism growing in your throat or wherever, in your pharynx, anywhere in your mouth?
Mm-hmm. Yes, anytime you see color changes, okay, the natural color of water is clear, colorless, clear water. If saliva and spit is supposed to be 99.5% water, it should be clear and colorless, right? However, because in the mouth we chew, we eat colorful stuff. We have food coloring in whatever we eat, in some of the things that we eat, and so many times this will color our saliva. If it will color whatever secretion is in our mouth that is coming out. But after cleaning whatever that is, the saliva should go back to the clear color. Now, if the color change has nothing to do with what you ate, if it has something to do with a gum infection that is going on in the back, or there's a fracture, or there's a cut in the gum, there will be redness. The same thing that we talked about sputum. If there is blood, if there's streak of blood, if it is very bright red, that is recent, that is now, or maybe acute case. But if the blood has been there and somebody just sucks it out from the corner of their cheek, and the dark blood that has been there now mixes with the saliva or the spit, you will eventually have a different color. It will be a darker color, but that's still blood. Now, if somebody has pus, in the situation where we talk about, we'll call it pyorrhea. Pyorrhea is when you have gum infection and there's pus around the teeth. When you squeeze the gum, the pus comes out into the mouth, and it mixes with the saliva, and it mixes, and part of the spit now has pus. That color will be kind of milky, yellowish, milky color. All right. So the color, most of the time in the saliva, just has to do with whatever is going on locally in the mouth. Now, for sputum, the same way, if it is coming from the lungs, the color will depend on what is causing the sputum to be formed in the first place. Every one of us is secreting mucin lining our respiratory tract. That is why we are comfortable when we breathe. Otherwise, the air we are breathing will dry up everything, and then we don't have, and that place will be very uncomfortable for us. So the sputum, the color is very important. If it's clear to light whitish, then it's still within the normal limit. When it is yellow, definitely there's an infection going on. When it is green, definitely there's an infection going on. When it is brown, there's either infection or there is, allergic reaction, which has led to chronic asthma, or there's a COPD, that is partial or complete blockage of the airway, from obstructive pulmonary disease. If it is black, definitely that means there are black soot or black particles from the air or from the environment where the individual resides that is causing the sputum to be that color.
What about the odor?
Yes, the odor is very important. Every time you have pus does not have neutral smell. It smells like rotten beef, smells bad. And when you have the pus coming from the lungs, is the same smell as the pus coming from the mouth. Okay. And what I told, for those who are not in the last presentation, we'll talk about odor from the mouth. The commonest odor that you get from the mouth usually comes from blood. When you have somebody who has bleeding gum, that means it's a sign that they have gum disease. If you have bleeding gum and the blood is in your saliva overnight, your mouth will smell like raw meat. When you wake up, the smell of the blood mixed with the spit will make it smell like raw meat. But if you have decayed tooth that is not taken care of, or very badly broken down restoration like crown, or like filling that is chipped up, and you have some areas there that are exposed, that food has been collecting, bacteria has been working on them, it will smell like rotten meat. It will begin to smell like rotten meat, more intense, but it's very repugnant, very repelling. Now, if there is cavity, and the cavity is so dirty, and you don't do anything, you have not cleaned it, you have not brushed your teeth, that one will smell like sewer. like toilet, like the pit latrine, if you want to use it. Because if you say sewer, most people will not even understand what I'm talking about. But when you go to a pit latrine, the smell that you get from there is typical of what comes from the rotten tooth that anybody has in their mouth. It doesn't matter where the rotten tooth is. And I challenge anyone who has a rotten tooth in their mouth to put toothpick in there and stir it up and smell it. You will run to the dentist and say, help, help. So, but anyway, I hope that answers your question.
Thank you very much.
Thank you so much. Dr. Craig, you have some questions in the chat box. I'm going to ask you to please unmute and put them together because there's quite a few of them.
Thank you, Dr. Ajagbe. As usual, you have brought clarity and information to our living space, and I appreciate that very much.
You're very welcome.
Several things I've questioned. In the very beginning, you mentioned sputum and phlegm. Are they the same? First question.
Mm-hmm. Yes, they are the same.
Good. Okay.
Phlegm is the lay terms used for sputum.
Okay. You also mentioned that some of the color of our mucus and or a spit and or sputum would indicate that something is gram negative. Are you saying that our secretions can speak to gram negative or gram positive?
No. I'm talking about when it is green. When the sputum is green in color, it's a bacterial infection. And most of the time, the bacteria that cause that kind of color of the sputum are gram negative and anaerobic.
Anaerobic, okay. You also mentioned that, about mucus. Now, there are foods that you are probably more than aware of, which are mucogenic. So they create an inordinate amount of mucus in the just below the pharynx at that point in time. And, that is significant. And as someone who has seen it, so to speak, I often believe that a mucogenic food is creating a subclinical allergenic response for the body is producing something to stop something from occurring. Mucus stops the flow.
Absolutely. That personally I experienced. If I ate anything that contains soy, disguised in any form, for instance, as soon as it touches my lip, I begin to have thick mucus secretion in my throat. I've not even swallowed yet, but just the trace of soy, of any kind of, any product, byproduct from soy would do that to me. Now, mucogenesis is a form of defense. However, if it is too much and you are unable to control it, it can become a big problem. Because if you have so much mucus secretion in the lungs and all the lining and you are unable to cough them up quick enough, you're not going to get enough oxygen. So yes, there are mucogenic substances, not just food, but that can cause that to happen.
One of the points you brought forward about the enzymes which are in the mouth, that is a critical point, because that's where, truthfully, digestion commences. And if the buccal cavity is in any way damaged or problematic, our process of digestion, getting the quality of nutrients out of what's putting in our mouth is interfered with. And I'll just even use one of the items, B12. B12 is significant, and I believe it commences in the buccal cavity, as does also vitamin C. But what kind of vitamin C? So we have all these things which are important, and if the buccal cavity, the mouth, whether it is the spit, the sputum, and or the mucus interferes with that, we're running on empty, so to speak, in terms of being able to get the value of that nutrient.
Yes, you're absolutely right. The problem that could arise with that kind of interference will be if there is salivary gland disease. I didn't say too much about what conditions will make the mouth dry. For instance, when you have a the Zika complex, when there is a dryness of the mouth, dryness of the eyes and the genital area, because there's inflammatory process that is destroying the salivary gland and the glands of the eye and the glands of the genital area. If that is going on, definitely it will affect the enzymes, and it will also affect the fluid content as well as lubrication of the mouth. Yes, we do also have yeast in our mouths, but not the kind of yeast that we need to produce the cyanocobalamin, which is the vitamin B12. We do, that being present in our mouths is necessary to balance the microorganisms in our mouth. So, yes, we must be able to have enough enzymes to help us process the food so we can benefit from the ingested food.
You also mentioned the sublingual, which is just below the tongue on left and right side. That is a route that bypasses the stomach when we're taking medication or different things, so it doesn't, so it's not destroyed by the acidity of the stomach. When that sublingual area is impacted by whatever, and disease or improper hydration or whatever, our ability to absorb that particular item, which is now sublingual in terms of being absorbed, is interfered with. How often is that sublingual area impacted by what we do?
Okay, well, thank you for raising that up. The simple mechanism that takes place under the tongue is the secretion from the sublingual gland is more mucoid than watery. The reason they stay there when you use things like nitroglycerin for somebody who is having a heart attack and pop a pill under the tongue, what it does is the temperature and the mucus secretion causes the tablet to dissolve. Now, once it becomes dissolved, the floor of the mouth is one of the richest places with very fine capillaries and blood vessels. The network of blood vessels in the floor of the mouth is immense. And so the absorption goes directly through the mucosa, the lining of the floor of the mouth, and it will move directly into the capillary space. And that is how it goes into the bloodstream. And it bypasses the acid, just like you said. That is one of the quickest routes. As well as the alcohol. We have to remember that when you drink alcohol, the first places that you absorb alcohol by is in the mouth, and it's usually from the floor of the mouth. And the reason for that is the lining of the floor of the mouth is non-keratinized. Well, that's a big word. It means it doesn't have layers like our skin does. See, because it doesn't have the kind of layer on the skin that protects the skin from getting water or dust particle to go through the skin to the deeper tissues. Some chemicals and some substances can go through the lining of the floor of the mouth directly into the bloodstream.
Again, this is wonderful. Thank you for bringing it forward. It is something that we take for granted. You answered one of the questions already, and I'll just emphasize it. The need to be properly hydrated. It's critical.
Yes.
And also hydrated with proper water, because all the waters that they're selling us now in the marketplace are not really waters. They are just fluids that have been adulterated with any kind of thing they think they want to put in it, and they call it water. And that's unfortunate, but hydration is absolutely critical.
Yes, you're absolutely right.
Thank you so much. Oh my gosh. Just to, add to that, if you get thirsty, it's too late. We should drink through the day and not wait till we're thirsty. I actually made a note of that to say that. So thank you so much, Dr. Craig, for bringing that up. So, Dr. Ajagbe, there's a question in the forum by Auntie Susan Oshifade that says, how long should one wait to see a professional after the initial treatment of sputum with herbal drugs like garlic, anti-inflammatory or antiseptic agents inclusive?
I think I need some clarification. Is this question referring to somebody who has ingested herbal products, and how long after ingesting such should they submit their sputum for examination, or is it? I need some clarification. I'm sorry.
Thank you, sir. So, Auntie Susan, I'm sure she's at work. So, but if you can speak, ma, or clarify in the chat box, I'll revert back to you. Sister Lola, you have your hand raised. Kindly unmute. You have the floor.
Thank you again. I want to know what's the advantage or advantages for drinking water very early in the morning, like first thing first after brushing. I hope I'm not deviating from this topic.
Absolutely not. It's right in line. Thank you. Thanks for the question. Dr. Ajagbe, over to you, sir.
Yes, it is not detrimental. It's beneficial in every way. First of all, it just replenishes whatever water you have lost, either by urinating or by spitting out, when you got out of bed. Because it's almost like intake and output, they have to be balanced. We have to continue to, like Dr. O pointed out, hydrate as frequently as we can during the day. You don't have to drink in gulps or large volumes at a time, but at least you can continue sipping and just adding whatever you might be losing as you breathe. As we breathe, the air itself takes out some of the moisture from the lungs through the nostrils outside. If you don't believe me, get a cup of cold water and breathe on that, and you see the condensation that will take place there right away. So we are constantly losing water, and if we don't replenish, we will be shifting the balance in the direction of dehydration. And like Dr. O said, if you wait until you are thirsty, you are way too late. In that shift of the balance in the direction of dehydration.
Thank you. Sister Lola, was your question answered?
Yes, I'm looking at something in relation to the heart.
Yes, okay. The body is made up of fluids. You have fluids flowing in the blood vessels, you have fluid in the lymphatics, you have fluid in organs, you have fluid in the gland system. You have fluid even in every single cell in the body. So once we are dehydrated, it affects every system of the body. We may not be, paralyzed. We may not be down and very sick, but we could get sick if we are severely dehydrated. So it will affect blood pressure. It will affect the flow of blood if you are severely dehydrated.
Not only
Thank you.
that.
Thank you. That's my question.
Thank you. Dry mouth, Dr. Ajagbe, isn't it bad for the tooth?
Yes,
Dry mouth, it will cause tooth decay.
I raised that earlier. Yes.
Oh.
Yes, I raised that during my presentation, that when you are dehydrated, your mouth will be dry, and that will increase the plaque formation. And when you get plaque formation, it destroys your teeth and it destroys your gum, and it gives you bad breath.
So thank you, sir. Dr. Booker, my darling sister.
Thank you. Dr. Professor, you took me right back to physiology. Thank you so much for that lecture. I really enjoyed it. Now, my question is not, let me put my face on so you could see. My question is from before. I use salt water to brush my teeth, and you were talking about baking soda and peroxide. Is salt water okay?
Well, salt water is antiseptic, depending on how much salt you put in the water. Okay, so normally when we do extraction or do surgery in the mouth, we tell the patients to rinse with warm salt water 5 times a day. And that way we don't want to introduce anything that can contaminate the mouth by just saying, just rinse with water. The salt water that is warm actually slows down bacteria, replenishment or, growth in the mouth, and more so in the area where there is infection, or more in the area where there was surgery. And we want to make sure that at least that place is constantly being rinsed and cleansed, because that is what our saliva does normally. That's why we cannot afford to have dry mouth. If our mouth is lubricated, we will not have all these things that we are talking about harboring in our mouth.
So next question, when you do baking soda and hydrogen peroxide, do you mix it each time, or you have a set for a solution for about 2 days or so?
Well, that's a very important question. Yes, it's better for you to mix it fresh every time you want to use it.
Okay.
Anytime you see hydrogen peroxide interacting with anything and it foams, it means it already releases the oxygen. The activation and the release of oxygen causes the foaming. And once it foams, it becomes water. So it's not going to be as effective anymore. So the activated oxygen is what you need to your advantage, because once you're in an anaerobic environment and oxygen is released into that the environment changes and the microorganisms will not survive.
Okay, thank you. One other question. Please talk about stones in the salivary duct, which I see, and people with dry mouth, people on meds, the guys who use meth, they have xerostoma and dry mouth. Could you just talk a little bit about that for us?
Yes. Okay. So dehydration generally can lead to I'm talking about protracted long-term dehydration will cause the saliva. Okay. Most of the time, the sublingual and the submandibular will have stone in their ducts. The reason is because they have more mucus secretion in them than parotid gland. Now, parotid gland too can have stone, but it's not very frequent. most of the cases will be right there in the sublingual and the submandibular area. And there is a condition that we see that we call ranula, in which case it looks like the belly of the frog, which is the same terminology for ranula. And what happens is when the ducts are blocked, the saliva does not flow out. And so the salivary gland becomes enlarged. Every time the saliva wants to come out, it pulls back because there was a blockage to the flow. It's just like any pipe. If you have blockage to your pipe and you are flushing, it's not going to go anywhere. I mean, the water will just be overflowing from the toilet over time. So the same thing, but the saliva will pull in the back, and most of the time it's very painful. I mean, it's not a very comfortable place to be. Most of the time, they will have to be surgically removed. You cannot just break them and let them come out. Because the stones are made from calcium and oxalates, and most of the time they cannot be milked out. You cannot just milk them, like pushing them along the duct to see if they will come out. They will not, because they are very rough. So the best thing would be to numb the place and then just cut the duct over where the stone is and bring it up, and the duct will heal back on its own.
Thank you very much, because I've done a few cases with that. And let's just mention a bit about people who, guys who take meth. They tend to have dry mouth.
Yeah. Okay, yes. When they take meth, they generally will crave sugar. They crave sweet. They crave chocolate. Once they are high, that is the thing. That's one of the side effects of methamphetamine addiction. And what eventually happens is they also, in their condition, do not drink. So they are severely dehydrated. So dehydration increases the plaque formation in their mouths. And when they eat a lot of sugar or sugary refined carbohydrate, they end up with so much decay. Almost all of their teeth are decayed at once. So you look at the mouth, and every single tooth in the mouth has a big cavity. I've had a few patients like that at the age of 21, a female that has no teeth, not a single tooth in the mouth. All the teeth were burned out, and the roots were covered by the gum. So when you took the X-ray of the jaw, you see all the buried roots of 32 teeth. For a 21-year-old, that is bad news. And some of them, we will have to remove all of their teeth because of this. The situation is grave for them. And they could die from the infections from those teeth by themselves if we don't do anything. So it's always a very bad place to be for them. Yeah.
Thank you very much.
You're
my favorite professor.
Thank you, man.
In retirement.
Thank you very much.
Thank you so much for those questions, interactions between you and Dr. Craig. I enjoyed it. I just enjoyed that. Dr. Ajagbe, sir.
Yes.
The question has been clarified. The question is, say you notice a colored sputum, do you recommend using a herbal product as first line? I think that's the first one. If so, which one, and how long should you use the product before seeing a doctor?
Oh, so if somebody observes that they colored sputum.
Sputum, yes.
Well, primarily, I would say if you don't know why your sputum is colored, you need to find out why. And so for you to find out why, it means you have to go to see your doctor, because if your doctor tells you you have, not you, I mean, the patient has TB, for instance, from the color, the patient cannot just go and start taking herbs. You gotta find some, direct cure or direct treatment for TB, because first, the most likely diagnosis for blood-tinged sputum will be for somebody who has chronic cough, for instance, will be TB. So taking herbs would not be very advisable. At least I would not be advising anybody to go ahead and start taking herbs, because they can easily access that. No. If you know what the condition is and you know the alternative remedy for it, yes, you can go for it. But I don't know of any alternative remedy for TB right now that I can tell somebody who has a blood-stained sputum to go ahead and start first. And then when it doesn't go away, to go and see their doctor. It may be too late at that point. So let's clarify that. If you observe any change in the color of your sputum, see your doctor. If you don't have a doctor, call Dr. O, book an appointment, go see Dr. O.
Thank you. I 100% agree. We should not be treating ourselves sometimes to get ourselves into big trouble for that. Dr. Craig, you have your hand raised.
Dr. Ajagbe, two things. I didn't mention this. When we do the COVID testing, we are testing the anterior nose at that point, and we are picking up whatever we're picking up. And that item on that prong is then tested for the COVID vaccine, the COVID virus, excuse me. Is that coming up from the lung, or is that somewhere laying dormant, or just laying between the interior back of the mouth and the top of the pharynx?
Well, that's a very strange situation. I mean, for me, it has been controversial. I think what they're looking for could be found anywhere. I mean, because the COVID is a viral infection. And if the cells that have, like the white cells that have been fighting the COVID, infection, they will be found in the secretions. They will find in the mucus secretion of the nose. They will be found in the mucus secretion of the throat. And so that's why they progressively they started with the nose. And they are not doing it from the anterior nares, though. They are going a little further. That's why it's very uncomfortable when they take the sample. They go to where it is wet. Mm-hmm. And then in some cases, they combine it with a throat swab as well. They go to the back of the throat and try to take some sample also from there. Now, for viral kind of infection, they are looking to do the polymerase, the PCR. So the PCR, they don't need to see the organism per se. They just need the genomic content of the virus. So that would be what they are doing, and they're not using culture like you would do in the case of bacterial kind of infection. So they are doing analysis, chemical analysis using the PCR.
Other question. When patients are seen with a very fuzzy white tongue, mm-hmm. It's automatically determined that it is Candida at that point, usually. It's a fungal infection. The curious part of it is that it's in the mouth at this point in time. And I know it's in the body as well, but it's in the mouth. So how is that occurring? What's happening there for us to see primarily when someone has a fungal infection, as in the case of Candida, we'd see it on the tongue and or in the buccal cavity.
All right, so not every coated tongue is Candida infection, by the way. So when you see the coated tongue that is white, usually it is one of the clinical signs in people that have fever, a fever-based kind of condition because they are dehydrated. They are burning off from within. There's a lot of moisture evaporating from their breath. And so their mouth definitely will be dry, partially dry, and the tongue will be coated, particularly if the individual does not brush their tongue usually. Now, if some individuals have been given what we call the broad spectrum antibiotics, the antibiotics that not just treat the disease, but also destroys the normal ecosystem of the mouth. What would normally slide in is the yeast infection. How do you know the yeast infection in the mouth is very simple. The yeast infection in the mouth is what we call pseudomembranous, that it is easy to scrape off. It is not bound down to the underlying mucosa. It is easy to scrape off. And so when we look in the mouth and you see what looks like cottage cheese in the mouth, and not only on the dorsum of the tongue, under the tongue or in the cheek area and all of that, you know definitely you are dealing with yeast infection. And so that is easier to recognize than just looking at a coated tongue and saying, oh, this is yeast infection. If the whiteness is limited to just the top surface of the tongue, I would not look at Candida first or yeast infection first. I will, check on their other systemic conditions and see if they are dehydrated, and more likely because they are dehydrated, their tongue is coated.
If you see it in the mouth at that point, is it septicemic?
No, you mean when you see yeast infection in the mouth?
Has it already gone into the system, meaning that it is now septicemic and it's
still local. It's still local. Usually the mouth will be the first to show that there is a shift in the bacterial ecosystem. So if that is the case, you will, if it's a female, you may check you may also ask questions about their private area. And so if it's in both, yes, you can see that the bacterial system is not just shifted in the mouth, it's also shifted across the body. So unless you do a blood test and you can actually retrieve or culture Candida from the bloodstream, you cannot call it septicemia. You cannot call it Candida septicemia. The fungus must be in the bloodstream for it to be septicemia.
Understood.
That's correct. So there's another condition. There are others, but HIV, actually not HIV, AIDS, full-blown AIDS, cause people, most times to have that yeast infection. And by the way, Candida is yeast in the mouth. So they would have it. They would have that, and that one you cannot scrape off, like Dr. Ajagbe, beautifully explained to us. It has to be treated and cleared. So in the case of AIDS, when we used to diagnose HIV at the point of AIDS, I saw a lot of that. But now,
yeah, I gave a lot of training on oral manifestation of HIV for years. And that is one of the earliest signs of AIDS. Not just HIV infection, but it's moved on to, the advanced stage of the disease.
Thank you, sir. So there's a question from Sister Ibidun. Sister Ibidun, hi, all the way in Nigeria. She's not sleeping yet. So she says, thank you very much, Dr. Ajagbe. Do you agree that we can derive vitamin B12 by scooping and licking the saliva under the tongue as we wake up in the morning? This is similar to what Sister Lola asked. I think it was Sister Lola. Before you brush in the morning. It may sound very gross though.
I'm not sure I understand. I mean, scraping your tongue and putting it under your tongue to get vitamin B12?
She says, do you agree that we can derive vitamin B12 by scooping and licking the saliva under the tongue? You know, it's using your tongue to scoop that and to swallow it as you wake up in the morning before you brush your teeth.
Well, I'm not familiar with any study that it's that. And if there's any indication that vitamin B12, which is cyanocobalamin, exists naturally in the oral cavity, I'm not familiar with that. So I'm open to learning if there's a new development about that.
I don't know about that also, but I have a question for you about morning breath.
Right. Yes. Mm-hmm.
So when people wake up in the morning, usually there is a smell. Mm-hmm. For obvious reasons, you've talked about that because we have, we have bacteria in the mouth that, live there. We have enzymes, we have all of those. And so when you don't talk all night long, you have that morning breath. But, brushing at night, would that help to eliminate it? Because since I started brushing, I don't have it anymore. Is that why?
Yes, absolutely. There's the when we eat, no matter when we ate before we go to bed at night, there is bound to be leftover food in our mouths. No matter how you try to do it while you are chewing your food, there will be some food left over. And, you have rightly said it, the combination between the enzyme and the bacteria, there will be release. Most of the time, the leftover of protein in the mouth is what actually becomes the sulfur compound, volatile sulfur compound that is causing the bad breath in the morning. Not so much about the carbohydrate that we ate. The carbohydrate that we ate may become a little bit alcoholic because when you ferment carbohydrate, you get alcohol, not acid per se. When the bacteria breaks down the carbohydrate is when they release lactic acid. And the lactic acid is what usually causes the problem for the teeth. So we have to understand which one is doing what. So the bacteria, when they act on protein, they release the volatile sulfur compounds that we smell. And sometimes it could be as offensive as hydrogen sulfide. That is, for those who did chemistry, you know what happened when you did the lab and you did hydrogen sulfide and you thought it was like a rotten egg. It's like, some breath can be that offensive. Yes. But brushing your teeth before you go to bed definitely will reduce by almost 80% if you still have some breath. Now, if you still have very bad breath in the morning when you wake up, after brushing well at night, check if you have restorations in your mouth. You have old feelings, you have broken down feelings, you have a gum issue. If you have gum issue, definitely when you wake up, you may find blood in your saliva.
Thank you so much. You know, during your presentation, or I think you mentioned it, you said something about bleeding gums.
Mm-hmm.
Okay, so just information out there, because I used to have that years ago.
Mm-hmm.
And I was advised to floss.
Mm-hmm.
And within a few days, it disappeared.
Mm-hmm.
And you know my gum health.
Mm-hmm.
You've given me a clean bill of health. So, so flossing is very important, in eradicating the bleeding gums. It's
yes.
important, correct?
Yes. Well, usually what happens is when you have, the spaces between our teeth, when the teeth are touching very well, they are very tight. And anything that goes below that tight junction usually causes stagnation of food and all of these things. Now, if you're unable to clean, for instance, if you chewed beef or any kind of animal protein and it gets stuck between your teeth and you did not remove it, you did not floss it or you remove it for 2 days, if you remove that eventually and you bring it to your nose, you'll be so shocked at how rotten the smell is. So the bacteria will decompose protein, and when they decompose protein, they will release the volatile sulfur compound. So that's where the bad breath is coming from. So flossing will help you get rid of that and also remove plaque that your toothbrush cannot reach between your teeth.
And that eradicates the bleeding gum.
Yes. Mm-hmm.
Okay, thank you. Sister Ibidun, all the way from Nigeria, she's still up. Kindly unmute.
Yeah, thank you so much, Dr. O. Thank you, Dr. Ajagbe. That was a beautiful presentation. I just want to
I just wanted to tell Dr. Ajagbe, she left us in the US. And, first went to Britain. And now she's landed in Nigeria. Enjoying the nice weather, right?
Yes, ma'am. Yes, ma'am. So I was going to tell us about the information I got, in a presentation made by one Professor Walter Veit. You can please Google it, Walter Veit. He talked about your health, your choice, and he said that for vegans generally, that people always ask, where do you get your B12 from? And he says we can produce B12 naturally. That's the first thing you do in the morning. You just use your tongue to lick the saliva under your tongue, and that's your B12. And I believe I can testify to that. I don't do much of B12 supplements, but I've tested myself of B12. What do you call it now? Anyway, I don't like B12. I do that every morning, and I've been doing it religiously for the past 10 years, and have been able to live on that. So just
thank you very much for sharing that. That's fantastic. I'll check it out. Yeah, thank you.
Thank you, sir.
Thank
Professor
you.
Walter Bay.
Walter Bay.
Walter Bay.
Oh, Walter Bay.
Walter Bay. Walter Bay. Thank you. Your health, your choice.
Mm-hmm.
Thank you. So, Dr. Ajagbe, there were so many thank yous.
All right.
In the chat box. You're very well appreciated. And thank you so much.
Thank you all for your patience.
Are you kidding me? This is another difficult subject. When you're presenting to colleagues, it's much easier because you can just flow. But translating what you learned in Latin into English, and and making it clear, for us to understand has been awesome. Thank you so much again. Can you give us
rounding up
caveat advice, please?
Well, so we cannot overemphasize or emphasize it too much that hydration is imperative. I mean, we can, if it's one thing, if our whole body is 70% water, then we owe it to ourselves to maintain that percentage, not to let it go below certain threshold of water content in our body. So, or water V, okay. What we need to remember is that saliva is not synonymous to spit, and spit is not synonymous to sputum. So they are different because by their definition, their composition explains why they are different. So once we know this, anytime you are coughing anything up from your lungs, you know that is dealing with respiratory area. And whatever sputum, you look at the color. And if the color is very challenging, then you must go see your doctor. You must seek help. Let somebody tell you, oh, okay, don't worry, it's fine. I mean, it's good to get a clean bill of health, even when you are a little bit concerned about what your situation is, than for you to say, well, I don't care. I mean, it's yellow. I'm not feeling terrible. I'm not feeling bad. So let me just take herbs and all of that. Don't do it. Just check with your doctor. Let them tell you, oh, it happens sometimes, or maybe it's really bad situation. You need to be treated formally. When you don't drink enough water, you know definitely your mouth is going to dry up. And if your mouth dries up, it's going to cause a lot of problems. One of them would be bad breath. That's number one. Your talking will be a little difficult for you because you need saliva to lubricate your mouth as your tongue is moving back and forth as you speak. Swallowing is very imperative for all of us when we are alive. Even those people who are on nasogastric tube, that is, they are being tube fed, they still need something to go into their stomach. They may not be able to swallow through their mouth, but the swallowing motion is imperative. We all need that. So saliva will make swallowing very easy for us, whether we are swallowing our own spit or we are swallowing food or drink, we need saliva to make it happen. So at this point, I just believe that once we know the differences between the three liquids or the three fluids, we should be able to ask the right question from the professionals to help us decipher what our conditions may be. Thank you.
Thank you, sir. I'm sorry. Dr. Craig has his hand raised, so I'm going to ask him to unmute. Go ahead, Dr. Craig. Thank you so much, Dr. Ajagbe.
One last point, and I'm just echoing Dr. Ajagbe. Water critical, but I also want people to start reading the label of the water that they're drinking. They are adding things to our water. In particular, something that is very common, something that actually my grandmother and grandparents soaked her feet in. Epsom salts are now being added to our water. We need to read the label, and it's in, let's just say, maybe 70% of the products in the marketplace. Anytime you see a water that says it's purified, it's usually in that water. So just read the label. Dr. Ajagbe pointed it out, critical hydration, but you need to read the label. Thank you.
Why Epsom salt? That nonsense. It's a rhetorical question.
that's another conversation in and of itself in terms of why they're doing it.
Yeah, I think we talked about it before. One other thing that raises up is the issue of pH. The pH in our mouth should not be acidic, because whenever our saliva is reduced, we get to be to shift into the lower pH, and that is acidic condition in the mouth, and that always causes problem. So the water that we're drinking also can change the pH of the mouth, and that also can cause problem inadvertently, because if, like Bill just said, if we don't check the label and we're drinking water that is very low pH, then I just encourage destruction of our teeth and also encouraging growth of bacteria.
Absolutely.
So one more, my sister Marian from Nigeria. She's not sleeping yet. Marian and I grew up together. We've been together for 15 years. Right, Marian?
Yeah.
She's been my best friend for 50 years. You have the floor.
Thank you. Dr. Ajagbe, well done, sir.
Thank you. Mm-hmm.
Yeah. I just want to ask you concerning this hydrogen peroxide.
Okay.
There was a time I went to the pharmacist here in Nigeria, and I bought hydrogen peroxide consisting of a benzoic acid and water.
Mm-hmm.
So what can you say about it?
That is dangerous, very dangerous. Do not use it. Anything that has benzoic acid in it is not good for you. It's not for your mouth. It's not for consumption. Don't put anything that has benzoic acid in your mouth. Unfortunately, those who are doing that, they are cheating. They do not want to give you the exact content that you're paying for. And they're just like they're adding all kinds of things to other stuff. So don't do it. When you look on it, it must say 3% hydrogen peroxide. If it doesn't say that, don't buy it.
Thank you.
You're welcome.
Thank you so much, Dr. Ajagbe, and thank you everyone for participating tonight. I have learned so much. And I'm so grateful, always grateful for being here. So till we meet next week, please stay safe.
Thank you all.
Enjoy one another. Enjoy one another.
Thank you, Dr.
Thank you.